Doctor, Doctor, I have a question for you. Why is it that people who take BP drugs are told to take it for life? And even while on that drug, some of them still end up having aggravated cases like stroke or heart attack. Why is it so?
Wow, a very good and interesting question, really. High blood pressure. You see, for us to understand it very clearly, let me explain briefly what high blood pressure is. You see, the way the body is made, there is a normal space in the blood vessel that blood need to pass through. In other words, this space is what nature has made available for the volume that the heart is going to release to pass through without any problem. If for any reason there is a narrowing occur, which say, let's say maybe as a result of, for instance, atherosclerosis, maybe clogging of the walls of the arteries with fatty substances that have reduced the space made available by nature, then the heart will still pump the same volume of blood. But you now know that the pathway has become narrow. It's not as wide as it's supposed to be. Now it has become narrow. So the heart must exert pressure to push it through so that it can pass. Otherwise, of course, persons will have to pass on that. Now, the pressure that the heart is exerting in order to ensure that this blood pass to wherever it's supposed to go through, that is where the name high blood pressure came into being. Now, remember I said that the reason in this case why the blood vessel become narrow is because of maybe fatty substances that have blocked the pathways. Now, when you are placed on BP drugs, what majority of them do is they change the viscosity of the blood from something that have coagulated, something that is normal, to a very light nature. Let me use palm oil as an example so that you understand what I'm saying. If you put palm oil in a cake and put it on the ground, after some days it will coagulate, it become thick. But this same palm oil, if you put it on a fry pan and fry it, it becomes very, very light. And that is what majority of these drugs do to the blood. They lighten, they fry and coat the blood so that it can snake through. It can snake through the narrow path that is still left. Now, when that happens, the heart does not need to exert any pressure for the blood to pass through. So if you check your BP at that time, it will read normal because the heart is not exerting any pressure. But the problem here is this. If you don't do anything to remove the blockages, the fatty substances, then you keep on building and building and building. You'll be changing drugs to be changing the viscosity as it is necessary. Then a time will come where this fat will eventually close up the artery, and then even the light blood can no longer pass. And that is the reason why the lack of stroke or heart attack comes into play, because if the blocked artery is the one that is going to the brain, then that is stroke, partial paralysis. And if it's the one that's going to the heart, then that is heart attack. So the drug that you are taking is only changing the blood viscosity so that it can become so light as to be able to sneak through the blockages. It is very, very necessary for you to take care of the underlying factors, the underlying causes, which is in this case, as an example, the fatty substance that's trying to block the pathways. So which means you need natural medication to remove the pathways, to free the pathways so that the blood can flow freely. So you are taking orthodox drug not as a cure. You are just taking it for palliative purpose. You are just taking it for, to symptomatically to bring down the blood pressure by frying, by changing the viscosity of the blood. But if it is herbs or natural medicine that you are taking, It will not tamper with the viscosity of the blood. It will rather go into the blood vessel and be fighting assiduously to remove the blockages, which does not happen overnight. You can now see the reason why some people they are placed on herbal medication, and then they will say that after taking for 1 week, 2 weeks, no, it's not working. My BP is still high. Not knowing that the herbal remedies that they are taking is seriously struggling to remove the blockages, the fatty substances in the blood vessel, so that the blood vessel can become open. And when you succeeded in doing this, when you're able to do this successfully, then you can say that you are free of blood pressure. You can say that your blood pressure has been cured. Without that, nothing cures the blood pressure. So that's the reason. They are placed permanently on BP drugs, because the BP drugs is not removing the fatty substances, the underlying factors. It's only changing the blood viscosity. And you need to keep doing that continuously for it to continue to work the way they want it to do. And eventually some of them still develop stroke, because that underlying factor, that is the building up of the fats inside the blood vessel, nobody did anything about it. So it keeps building and building until the blood vessel becomes blocked, and then the brain is now deprived of the necessary flow of blood and oxygen, and that will lead to an explosion, which we call partial paralysis. Thank you very much.